It's Mario and Alex time.
It is.
The two favorite chiropractors for El Paso. Okay.
Yeah.
We're going to
Functional medicine, Alex.
That's what we're going to do, right?
It's 2020, baby. Functional medicine.
2020, we're going to be focusing on BMIs, and we're going to be focusing on everything. Mario, my awesome co-host here, we're tearing it up. We're going to give some points of view. We're going to be discussing certain things. Today, our focus is going to be on anthropometric measurements and measuring the body composition, rationale, and its interpretation, baby.
I'm afraid of that.
All right, Mario.
I'm afraid of measurements, Alex. I'm telling you right now. I don't want measurements around my body, okay? Thank you.
All right, Mario.
Yeah.
Mario, we got to get a little knowledge here.
Okay.
Hey, well, what we're not going to do is we're not going to try to make this boring. So if you really want to see boring, I think we got plenty of examples of what boring looks like.
Yeah.
Have you seen those boring guys, Mario? You know, it's like the body measurement of what's going on.
I don't know. I got one over here.
Of how good the BMI is to diagnose obesity. So what we found was that BMI...
you know what? I can go to sleep with that one, Alex.
Yeah, that's what I'm talking about, Mario.
I can go to sleep and just shut it off. But, you know, learning has to be fun. It has to be interactive, and it has to be functional. So that's what we're about.
Absolutely. I totally agree. So what we're going to do is we're going to try to bring the facts as it can be, and we're going to try to bring it with a little bit of slapstick fun. So it's going to be fun. Mario, tell me a little bit about your interpretation of BMI as how people understand basal metabolic rate, or...
Well, this is what I understand and what I hear about basal metabolic rate. Bottom line is, can you put your belt around your pants and can you tuck your shirt in? How about that?
You know what?
That's pretty scientific right there.
That is scientific.
Yes.
That is scientific.
It is.
We could talk pear, we could talk apple sizes, apple shapes, body types, but we want to get specific here because people want to know what's going on here.
Let's start. Let's go.
So one of the things that we can do is we can start discussing calculating energy requirements, because one of the things that we want to see, as you can see, I put up here a little bit of facts so that it can help us out a little bit in terms of figuring out what's the best approach in terms of what we do. Now, you can tell here that sedentary, no exercises. What we want to do is talk about basal metabolic rate. Okay, so this is a measurement that is occurred by height as well as weight index.
Height and weight.
So it comes out to that number, and we can start looking at caloric intake burn. But when we do a BMR and we calculate this number, we typically want to get about a 1.2. And that's what would be normal in most situations. If you're sedentary, light activity, we start noticing that there's an increased activity expenditure, and BMR should be a 1.375. If you are moderately active, you should start doing that. So in its interpretation, Mario, when you see these kind of things and these kind of figures, what does it bring to mind for you in terms of these numbers? As we keep on going back to this, we'll be able to see exactly what's going on. What's your incentive sense of the rates and the metabolic processes?
Well, again, very simple. We need to look at it as the more active you are, the higher your metabolic rate is. That's it. So at the end of the day, we want to put it in very simplistic terms to the public. We want to be more active. How about that? So science is supporting that, park the car as far away as possible from the Walmart entrance and your work. So by doing that every day, you are creating a higher function, metabolic. That's the burn. That's your whole system burning fuel within yourself. So it's simple. And the studies are showing that the more active you are, the higher your metabolic rate is. It can go up to 1.9 from 1.2, correct?
Exactly. So what we're looking at here is that the requirements are going to be pretty high if you are one of those people that are very active. So ultimately, our goal is to get you as active, or what your lifestyle could require. So if you're a mechanic, you say moderately active. If you're someone who works in, let's say, an office, your BMR is going to be calculable using these numbers for the body mass index. The whole idea is try to figure out a body mass index using the BMR. So the BMR rate allows us to kind of give an estimate, a best estimate as to where your BMR should be at. And then we can use this same number, this BMR, to assess your body mass index. So our goal is to continue with kind of learning about this thing. And as we kind of go through that, we look at body measurement types. Now, in the past, what we've looked at in terms of this, we assess the body in a bunch of different ways. Historically, we've been able to do underwater weight assessments. Remember, Mario, we used to have like a tank and put someone in water, have them float, measure the oxygen consumption. Those were the old methods. The true standard way of doing our fat analysis, pretty expensive sometimes. We use a DEXA test. The DEXA is the similar test that is used for bone density. We can actually do that. We also have historically the body pod test. Now, I know that you have noticed different types of tests, and we're going to put up here, what are the tests that you've seen?
The other, Alex, on that one, when you're talking about the underwater weighing and DEXA and even the body pod, those are again, more research-based, more scientific.
Exactly.
In that. So when you're looking at that, I look at it from my perspective, what's functional? What can everyone do? So skin fold is easy.
Yes.
Skin fold and the
BIA
and the Tanita scale. Yeah. I mean, that one, electrical impulse is going through and you're looking at resistance and impedance. Those are simple. You can just buy from Walmart or anywhere and step on it. Make sure you don't eat and make sure you don't drink before you do your test. So do it early morning, let's say 6, 7 o'clock on an empty stomach, so you can get some good readings with the scan. And also, skin fold's easy. And again, with the BMI, you're looking at weight divided by twice your height squared.
Exactly.
So that's kind of like simplistic view in terms of BMI. Anyone can do it.
Yes.
So those are right now. Those are the standards. Those are the things. Most of the times, when you go to your trainer, most of the time when you go work out in your CrossFit gym or your what I call functional gym, now people are going into more a functional aspect of fitness. So they incorporate less wear and tear and trauma. Now they're looking at skin fold and InBody. They even have the new InBody systems that are very popular that give you a nice ratio even of your hydration, which is really nice.
When you actually say that, when we look at this thing like the Tanita, this scales, like you said, you can get them at home. The BIA is where it's at. What we're finding is that a lot of the studies are reflecting that the BIA actually shows quite correlation with accuracy with these more complex underwater weighing as well as the DEXA test. So these standards, research-based, you'd always want to maintain some sort of research-based, at least collaborative information that makes sense, right? So now the BIA assessment machines, they can actually determine through ohms, through impedance, through fat analysis, through actually measuring the electrical current throughout the body, a very accurate approach to weight assessment and basal metabolic rates. So now the studies are actually better and they're easier for people to do, and we don't have to do some real complex things.
Yeah, and if you can show everyone the body pod, I think that's really cool. That's like a cool thing, I mean, look at that. Can you? Yeah. I mean, that's like really cool.
So when you look at a body pod, right, this is an incredible thing, but this is not something you would want to have in your office, right? $30,000 to $40,000.
Right.
Jesus, man. This is like...
it's crazy. I mean, they're probably looking at you like they should have you on the Alien Channel or something. No. But the simple one, if you can scroll up on the BIA, it's a simple machine, and the readings are awesome. The readings are very good. They're portable, and you can see the resistance level, and you can see the phase angle, which is really nice because then you're looking at very specific patterns in terms of your metabolism.
Absolutely. These tests now are available in most clinics, or at least the clinics that focus on functional fitness.
Yeah.
We have them at the fitness centers, and many fitness centers have them. And you and I are used to using these things in our offices. So as we do these things, as we assess these things, we really can give kind of the patients a quantitative point of view that really helps them figure out exactly how they're improving.
You're exactly right, Alex. You know, in my work, working with athletes and also what I call performance professions. You
Yes.
know, we're talking about military, SF, special forces, Rangers, things like that. It's all about performance. So in that, we use calipers. Those are very, very useful, easy to use, and the one that I particularly like, which again with BMI, there are a lot of discrepancies, Alex, and you know this being in the world of bodybuilding and the athletics, and all of our kids are athletes. I mean, that's just part of the family structure. That's who we are.
That's who we are.
You got to run, jump, catch a ball, or kick a ball, or do something, right? So the point is, in that, what I have found out is that the BMI is not very accurate. Not very accurate at all, Alex, when it comes down to athletes.
Right.
So this is where the discrepancy comes in, where it gets crazy, because now you go to a regular assessment, or a regular, I don't want to say regular doctor, but your doctor, and then he'll test your BMI, and you're going to be off. You're going to be high, and you're going to say, you need to get your BMI lower.
Yeah.
But the point is that the BMI is the mass, right? So again, muscle is heavier than fat. So in your environment of bodybuilding, what do you think about that? I mean, because I'm sure it was crazy.
Well, one of the things that I've been able to see over the years is that when you have someone, as we understand this, that the BMR is obviously the thing that we're using to assess it. We're using height and we're using weight, but those numbers get skewed when you have an athlete, and they don't work well for the muscular individual. Someone that's my son, for example, he was 195 pounds, 5'8". In all reality, he's clinically obese, right? Yet he's shredded and ripped, and he was a national champion in wrestling and literally had no body fat. So the caliper method, the BMR, the BMI based on height and weight has deficiencies, and that's where the BIA came in. And the body impedance assessment, that's where these studies became very popular. And as what we see, Mario, is that in essence, when we look at these situations, we find out that there are great assessment tools out there. These tools are the ones that are actually going to give us the ability to kind of come up with an accurate, for a large range of individuals, whether they're bodybuilders, whether they're women. There's a standard between a good 13% body fat and 29% body fat for females. Women typically have a larger number, between 18 and 29% body fat at times. That's a range that is kind of in there. So hopefully they can stick around 22 to 24. Boys in the 13 range, just because the body density is different in a female, right? So what we look at is what's the norm. One of the things that we can do is try to calibrate people for their numbers so that they make sense for that individual and be able to work them towards it. Because a true athlete will be able to almost blow the BMI into the wrong number skew. And if we can get it to a nice number, we're going to have to use a lot of different tools. Now, what we're going to present today are our ideas and fundamental philosophies and knowledge points that we use to determine actual true health, right? So we're going to be discussing those particular issues, and we're going to go over those particular areas here. Now, the BIA is the bioimpedance, okay? So when we look at the bioimpedance areas, we can see that these kind of tests are not only just affordable, but they actually determine the electrical current. And because of the body amount of muscle fat and the fat that occurs, we're using the fat as kind of like the the thing that allows us to assess body dynamics as well as body density, right? So as there's more impedance or more ohms or more resistance in the body, the greater the body fat. So it's very important that these tests be done properly. Many of the times before you do a BIA, you got to kind of you got to not take. First of all, you got to be dry, okay? Because if you're sweaty, it throws it off, right? If you eat too much or too many fluids, so typically you try to keep away from eating foods prior to this, and you try to get this thing to work. So resistance, as we look at it, are the things that we're trying to measure. So one of the things that when you look at these particular graphs, you see low resistance associated with large amounts of body fat mass, which is where the body is stored, right? So when we look at this is one of the areas we can kind of put together when we look at the resistance numbers. Now, as we look at different angles, let's say we got the phase angles, we also look at the ability. This is the new number that is assessing actually the intracellular and extracellular activity as well as the permeability of the cells. Okay. Now, as we range this, they're looking at ranges between 0 and 20%. But the higher the phase angle, okay, the higher the number where it pops, the better it is for the individual. The lower it is, it's not as good. So what we want to do is we want to see where your phase angle is, and we want to be able to assess it as it gets calculated. So one of the things that we look at, we assess this, and our tools that we use, such as the BIA assessments, such as the InBody testing systems, we can actually determine the ranges that are for the individuals. But here's where things make sense. But what we're in general, when you look at this, Mario, what is your take from when we assess this particular type of fundamental research technology as we can apply it to athletes? Your daughters are athletes, right? And do you what have you used in the past for this?
Usually when they go into programs, I mean they're super fit, first of all, so they're looking more at anywhere between like performance in terms of speed, agility, and sustainability, right? Vertical, in terms of explosiveness, those type of things. In the area of recovery and energy, this is where I can tell you, with even the girls and even the boys, they really focused on the energy consistency, okay? And I can see even with this, which is critical, the phase angle. Again, the lower the phase angle, it shows the inability of the cell to store energy. So that's why that storage of energy, Alex, is real critical, because why? That is where we get the maximum output. And everyone is talking about performance, and performance is about what? Output. So if that cell cannot store the energy, it cannot release the energy and perform. So that's how nice. These are nice markers, I would say, that with the latest technology, we need to use them. And we need to have benchmarks where it's not just generalities. A lot of times we talk about generalities. How are you doing? I'm doing good. I had a good workout. Well, what does it mean to have a good workout, and what does it mean to have a great workout? The difference is, show me proof. Show me results. It's all about results. So the better, I guess, a good takeaway, a good kind of assessment for people to look at. Number one, go to a professional and get your BMR and BMI done. That's number one. And use the equipment and the specifics so you can mark and you can assess them afterwards. If you don't have a straight baseline, you will not have a post. And this is the same thing in performance. If you don't have your electronic time in track, your pre, then your post is meaningless. You really don't know where you're going. So for a lot of the performance to me, life is performance. You're going to have to perform either at work or at home, or you're going to perform on the field, whatever that may be, on the mat, on the field, in your sports. It's about keeping track of markers, your pre and post. That way you know where you're going and you know your performance. In our world, we love scores. Just imagine going to a game and you never have a score. We don't keep score. We just want to have fun. It's not fun anymore.
Right.
So for the things that we're covering today, in terms of the instruments, the methods of measuring body composition, all the way from professional DEXA and water displacement and body pods to skin folds, everyday use that you can just buy it at your local Walmart anywhere, and do the caliper test. That's a great baseline. And
Exactly.
with a lot of the trainers, make sure that when you are training with someone, make sure that they do a baseline. So you know and they know where you're at and the performance and the programming. It's real important to understand programming. There has to be a scaling. There has to be a periodicity in that development. And I know when little Alex was training for state, in wrestling, there has to be a periodicity. You can't just go hard and go home like everybody says. No, you have to have your point of performance, and you've got to have your track, your flow to that. Just like when Mia is training for nationals or international competition in tennis, there has to be a plan where she is developing to peak at that time. Is that correct?
Yes.
That's so critical. And you cannot create that plan to peak at that specific if you're in the dark in terms of having a knowledge of where you're at. And I think for our listeners and our viewers, it's critical, and it's very, very easy to get. I think sometimes people get lost, like, BMI. I would venture to say 80% of the people that are listening today or they're watching this video have no clue what BMI means. They heard about it, but they have no clue what it is.
Yeah.
They think it's some scientific something in lab. No, it's not.
Right.
We want to bring it down to earth, down into your living room, where you can actually do a BMI for your kids.
Right.
Yeah. Why don't we do that? Why don't we do a BMI for your kids? Do it for your husband, your wife. Make sure you know where you're at. Again, with a BMI, and this, refresh my memory, the target is 19 to 20.
Okay.
19 to 20.
Okay.
Anything beyond that is obesity. If you're talking about 25 BMI, you're in obesity range.
Right.
If you're talking about 30, you are morbidly obese. And the word morbidly obese means death. That should get everyone's attention.
Oh, yes, it does.
It does. It kind of like wakes you up. So what we're looking at is, number one, understand where you are, then measurements, and then also understand that these measurements fit the profile of the person. So if you're a bodybuilder, if you are very heavy muscle bound, okay, then you already know you need to go into impedance, not measurements. But what I have found out, a very reliable measurement is the measurement for your waist. And that's where, Alex, I want to kind of share this with our listeners and viewers. Just a simple waist measurement is so powerful because it is actually, some people say it's better than BMI.
It sure is. It
right?
absolutely is.
I mean,
actually, yes, it's very much.
Yeah, that waist measurement gets down and makes it so simple because that abdominal mass, that abdominal fat is the one that's going to kill you. That's the one that has the highest risk. Is that correct?
That's correct. And if your belly is it's wide, if it sticks over your belt, we got issues. Okay, so we're noticing that if there's a certain distance between the chest and the waist, those are better measurements in general.
Yes.
So as those numbers are calculated, you don't need a high level test to do this.
Okay.
So
I like that.
So it's an important component to look at. But as we advance and we're dealing with high performance athletes, people want to know, and you can take a sport like, let's say, just wrestling, for example. You got these individuals that
or soccer,
it's huge,
right? Huge, yeah.
Yeah, we're dealing with, to assess a tight BMI and a tight body mass index, you got to have body fat. You got to have body fat to be able to sustain the loads of an exercise routine. You're going to see that during season, you got some guys that got some good body fat density, right? And let's say their weight class is 198, for example, and the guy's about 215 pounds. Well, if he drops from 215 to 198 overnight, he's going to be exorbitantly exhausted. And this is something that we're going to see. Now, if he slowly works towards the goal, towards the arena of 198 over a period of 2 weeks, or if he's better off. But let's assume he gets there to the exact body weight at 198 and it's 3 days before competition.
Right.
It's going to be exhausting. He's going to be tired. However, if he can get there 2 weeks earlier and adapt his body, as his body starts getting better, it will be able to respond better during the loads that it needs. And
this is what we are talking about, that it needs to be sports specific. You follow me,
exactly,
Alex? Okay.
Exactly.
So that same conversation cannot be held with a soccer player,
exactly,
a football player, and a tennis player, or anything in that what I call long aerobic exertion of over over, let's say, 10, 15 minutes. And this is what's happening is. And I love it when you said that example with wrestlers. I would say the same goes towards MMA fighters, which I take care of.
Yes,
MMA fighters in Phoenix and in different areas. Then you're talking about also boxers. Again, they have to make weight.
Yes.
Okay. Though the world of making weight is a beast. That is a world where you have to be on or you're going to die.
Exactly.
You either go into that fight feeling like a beast, or you're praying that it ends quickly. And so yeah, it is, you got to pin him in the first 10 seconds. Yes. So this is where it's so important that the training, the measurements, the analytics and metrics. We're in a world of analytics and metrics, Alex. We're not in a world of, oh, he looks good. No, we're past that. We're way past that.
No, Mario, we're in the world of making sure that when we compare the athlete, we can measure their changes. And every stage down the road, as they compete, as they become more and more in tune to that moment of competition, their body changes. Their bodies adapt. Their bodies become more refined. And as the season gets better, or further along in the season, towards the competitions, towards the season, towards the heavy loads, that's when we can kind of see how the body's changing. So these tests can actually help us determine how the body reacts. And once these competitors have years of competing, and during those years they have off season and on seasons. And we need to be able to measure those things in an easy way. That's what these tests do. In terms of tennis, for example, when you've done these kind of things, what have you noticed in terms of, let's say, just the athlete of tennis, or even the boxers that you deal with? What have you noticed in terms of specifically the progression through the season? It's critical.
And Alex, I can tell you this, that it's not just performance. The other conversation that I think really needs to be dialed in is recovery. Recovery, Alex, okay? And the other one that fits together with recovery is
phase angle. Yeah.
Yes. And decreasing injuries.
Exactly.
That's where it kind of gets real crazy, because you cannot have this sustainable pattern without recovery, and without that specificity and knowing when to push it, when to max out, as they say, and when to shut it down or when to go half speed. And these are conversations that are really, really critical for young athletes, Alex.
Yes.
I see a lot of them, and they're starting earlier. They're starting at 6 and 7 years old. 6 and 7. Let me tell you, your body hasn't even woke up to the conversation of sports yet. And they are practicing 3 times a week, having games every weekend, or some of them practice 3 times a week with one team and then go with another team and practice the other 2 days just so they can be at their best peak.
6 or 7, Mario. So
crazy.
What sports are you dealing with that kids are doing 6 or 7?
They're running, like right now, I have patients that are doing basketball and track at the same time. Yeah. And they're in middle school. That's
Jesus,
amazing.
man, this is crazy.
Yeah. So this is my question, our question. We're here to help the community. We're here to help the parents because their vision is my little kid's going to be a superstar.
Right.
He's going to sign a D1 contract, UT Austin, Texas Tech, guns up, baby. Yeah. Guns up, or U of A, right?
Yeah.
U of A, Wildcats. Wildcat.
No.
Wildcats, and I'm thinking, you're not going to make it past high school. I mean, you're not going to make it past Montwood or past Franklin. I mean, you are going to hit the wall so hard with repetitive traumas, okay? And so those are the components that, to me, as a healthcare provider, as a sports functional medicine cognitive coach. I mean, I need to teach people this. I forget taking care of injuries. I want to teach you so you don't get injured. It's critical. And then they go into middle school and high school, and there's no season off. There is no season off.
So, in your opinion, what have you seen these tests do in order to help the parent or the athlete or the individual or the coach, for that matter, understand as a form of betterment for them? What do we get out of these tests in terms of the athlete?
Very simple. There's a time to turn it on and a time to turn it off. Okay? So you reach your goal, rest. Okay? You've done the tournament, recover. Get the recovery. Get the mind and body to recover, Alex. A lot of times we don't even think about the mind.
Yeah.
The mind, it gets beat up in the war, in the battlefield of performance. The mind gets beat up.
Yes.
Okay? It affects your sleep pattern. It affects your focus, emotions, anger management, all of those things. So what I would say is we're here to share knowledge and tools for health, but most of all for performance.
Yes.
So that way, each child and each person, let's say you're not in middle school or high school, let's say you're in your 20s and 30s and 40s. Well, you're performing for life. And so let's really invite everyone to learn more, to look up BMI, BMRs, all of these, and incorporate them into their plan of workouts. And challenge them and ask them, when's the last time you got measured? How about that?
Yeah.
When's the last time?
We have to kind of teach people that these tests are not, in any point just one test. You have to follow through these tests for a lifetime to see what's actually going on. If you really have a center where you can go to, and the BIA tests are so simple now that and the correlation between the highest level of research shows that we're very, very tight, less than 1% variation from clinical research methods So we know that the BIA works in terms of extremity inflammation, in terms of joint swelling, in terms of the metabolic processes for the mass density in each extremity. So if you have one muscle that is larger on one side as a result of an injury from the other extremity, we'll be able to see the changes. So the studies are very clear now. We use phase angles to determine health. We use fat analysis. We use the changes and the progression during a very athletic era or a very athletic season is very important to be able to determine. So that today we're starting the children a lot younger. We're starting them at 4, 5, 6 years old. As the child has to, around 4 years old, as long as they can focus, as long as they can pay attention, that's when we start them active. So it is wise to start the process of understanding the metabolism methods that we use to calculate body mass index through their ages, so that we have a measurement of what's normal for that particular child. Because what we really have to see is what's good for that individual. Specific gravity is another method to determine if you're cutting down too much, but that's another topic.
Right.
But this particular issue is particularly on the body mass index, and what we want to do is we want to bring that to the towns and to El Paso particularly, because we have those research capacities here. Specifically, the ones that we have liked is body mass indexes. So in InBody is one of the most top used. They use it at UTEP. They use it at the top research centers, and it's pretty much the standard now. And since we use it, it offers us an ability to quickly assess an individual. I've been at UTEP. I've seen the types that they use, and it's very accurate. And since we've seen the research that it follows, then now we know that this is very accurate. And specifically now, you can actually assess your own and have it online and determine it through a method where you can keep up with your child to see what's going on. Any other ideas, any other comments that you have, Mario, in terms of bringing this logic or this kind of approach to understanding basal metabolic indexes to the public?
I would say, Alex, number one, let's make it very simple. Let's make it very simple. So with that, this is as simple as getting on a scale to see how much you weigh. That's it. So let's bring that conversation to everyone, so everyone gets a scan. Minimal, I would say seasonal. Every season you should get a scan. You should get a BMI. You should log it in just like your weight. Let's be functional. Let's think of ourselves as important as our cars, right? So I look at it as you have a little tag up on your windshield that says oil change. So why don't we do this? Why don't we have, and I really challenge everyone listening, and we're here because we need to take care of our community. Our community is probably one of the highest rate of diabetes in the nation. Okay, and all of that.
Mario,
so it starts.
Mario.
Yeah. I'm sorry.
I don't want to say it, but you have to. There's a big old elephant in the room. But El Paso, our town, was considered the fattest, sweatiest town in the whole United States at one point. That sickened me when I heard it. It was a different town. We are much more advanced. There were very few gyms. Now we're all about fitness. So if we're going to be the leaders out there, and man, I got to tell you, we got some beautiful athletes coming out of El Paso now.
Absolutely.
Okay? We got one of the tops. We can put our athletes against the best, even the most well-bred top schools. So as we compete in those areas, we really want to use the tools that all the other places use in order to assess our athletes, our children, and our high-performance individuals. So it's very important we do that kind of stuff now, because we have the technology, and no longer is El Paso going to be the fattest, sweatiest town of the United States. That's unforgivable. You definitely agree with that.
Yeah. So just bringing that, and the vision that I would like to share is that the measurement, the simplicity of just getting your weight and your height is now complemented with a BMI that you understand. You have some goals. It's 2020.
Yeah.
Yeah, it's 2020, baby. You know what? 2020 means that let's do better than last year. Let's be healthier than last year. And let us integrate and have a better understanding and better objective plan for our own health. And with this, I would say this test and the body measurement index is a word and a understanding that needs to be spread throughout families. So the family can talk about that, like, hey, what are we doing? How are we doing? Okay? And then with that, use it accordingly, okay? Accordingly to create positive outcomes, whether it's just to be able to play with your child. If you have children, that's your sport. Your sport is not to sit and watch. Your sport is to participate. Throw the ball, kick the ball, run with your child. Or if your child is really into sports, give him the tools, give her the best tools. They're not that expensive.
No,
they're available. So that way they can get training that is on point and results that are extraordinary.
Exactly. I couldn't have said it better myself. We have the technology. It's here. This is not the $6 million man kind of world, or this is not outside of our realm. We can give it to our kids. We can show them. Parents become the educators. They are the ones that seek out the coaches. They are the ones that are the nutritionists for the children. They are the ones that are the psychologists. That every aspect of developing a child requires a lot of different aspects. So those parents that have athletes that want to learn more about their bodies, the world of heavy tech research methods are over. Now it's simple. You get on scale, really accurate methods, and you can monitor your body a few times a year, 2, 3, 4 times a year, depending on your type of sport and your level of performance. These are the things we can do, and we need to provide that information so that you have tools in order to gauge. You can't get in a car without looking at a speedometer. Exactly. You don't know how fast you're going. You don't know if you're going too far. You don't know if you're having protein metabolic catabolism, which is breakdown, or if you're anabolic. So these are the tools that help us figure things out. You don't know if certain joints or certain extremities are swollen because of just water, or if it's just protein breakdown. These tools we can actually see inside the body and monitor the improvement or changes. So the world's changed. So now, El Paso, we have the ability to change the way we understand our own physiology, as well as the patient's physiology and our clients' physiologies. So I welcome this technology, and by no means is it limited to anything that we do. This is many providers in the town can do this. Many hospitals have it, but for facility, it's within our practices as well. So we use those things. So I look forward to being able to share this with the patients as well as the town.
Absolutely. I second emotion on that, Alex, and the challenge and the motivation and passion that we're going to have this year in 2020.
Absolutely.
Is to not only motivate and be cheerleaders for functional health
and fitness,
and fitness, but also to educate and empower the community with the latest technology and knowledge so they can do their best.
Amen, brother. This is awesome, and I look forward to being able to continue. We're going to be coming at you often because we're motivated. We're parents, and we want to be able to touch our El Paso and make it a better place because, without getting too crassy, we're pretty badass, as they say, right? Yeah, we were pretty intense in our town, right? Yeah, Mario?
Don't get me started. They're gonna have to shut me down.
No. We won't do that. We'll come back later, guys. We'll go ahead and see the show, and it's been a blessing. So from all of us here, we can actually see how you guys are doing. So blessings to you guys. Thank you, guys. Bye-bye.